Let's wait 5 minutes more, then we will start. Today we will discuss about toxicology part 2, that is unit 2. What are different types of toxins and how it reacts in our body. Let's wait 2-3 minutes, then we will start. Let me share my screen. Am I audible?
Yes, sir.
Okay. And screen is also visible to you?
Yes, sir.
So, last class we have discussed about what is toxin and what is called that is poison, or how it is effect in different person, because it varies person to persons. So what is a poison? Anyone? Just recall the previous class. What is the definition of poison?
So, may I?
Yes, yes, you can.
All substances are poison. Right dose of anything is important.
See, okay, okay, very good. There is nothing a specific definition, but every substance which may be overdose or we cannot be tolerate our body, that is called poison. But there are specifically some chemicals which are having more reactive to our body. For example, let's say different types of pollutant, and there are also very toxic substance like we can call as snake venom, cyanides. So these are various different substance which are react in our body very quickly also, and also depends on how it responds to the body. So let's start with our next thing, that is called toxin. So what is toxin? Toxin is a chemical, like what that is a poison. So again we are just revise these things. Toxicology, that is the word toxicology is derived from the toxins, and which is mean for poisons, and it is defined as a scientific study of the poison, that is the toxicology, on the effect of human, or particularly human or living organisms. So another term that is called genobiotics. Genobiotics, geno means the Greek term which means strange or alien, and their substance are foreign in our body. So it also react in our biologically. So that also comes under this toxicology, because genobiotics, that means for that is a term that is related for the substance which is not created in our body and not useful, and that response of the substance when the substance enter into our body. For example, those chemical or the toxic, the substance is not required in our body. Let's say some substance, and if it is enter into the body, then react in a various way. So that is called foreign alien body. Genobiotics means alien substance, or that substance is not required in our body or not be recognized in our body. Then how it reacts? That is, and that substance called genobiotics. For example, so if you are the dioxin or some pesticides or some insecticides, which are the substance which are not required in our body and that can react immediately, that is called genobiotics. But common like sodium chloride or potassium chloride, these are required in our body, but excess amount of substance which is also react, so that is comes under uh, chemical substance. But when we're talking particularly genobiotics, that is the simple example is some kind of allergic things. So that if you are not recognize that things, then how it can react in our body. So broader term is poison. Poison is a substance which is taken a small or dose, that depends on that. So toxins, special types of poison. See, poison and toxin, there is difference. Toxins are special types of poisons that produced by living organism in small quantity. So this is the exact means definition of toxins. For example, the venoms or some other insects when you bite, they bites you, the chemical substance release in your body. So toxin is the substance produced by some living organism and which react in our body. So these are generally classified in the biotoxins and phytotoxins, some substance that are created by the living organisms like plants that are called phytotoxins, and substance which are generated by the animals that are called biotoxins, and some substances are called myotoxins, that is fungal infections, fungal substance, and the zootoxins, toxins by lower animal, that is buffalo toxins, snake venom, etc. Bacterial toxins, they are classified into different kinds of toxins because toxins is the substance which can produce by different living organism, maybe plant, uh, fungi, bacteria, etc. So these toxins are, for example, it is given as venom. It is a toxicant synthesized by specialized gland and ejected by the process of biting of stinging. So, for example, snake, they are producing venom. They are actually producing venom because of their self-defense, not to harm others. But whenever someone is accidentally or their bites, the venom is injected to other body. Venom is also called as zootoxins because transmitted the process of the stinging. So whenever it is, when the toxin is entering your body without from a substance or by mixing in your blood, it cannot be react. So this is uh, an example of zootoxin, that is I call it biotoxins or venom. Then toxicity, it is maybe defined as the inherent capacity of substance to produce the toxic effect or changes in organism. So how this toxin is response in a particular organism, then that is the term called toxicity. So this toxicity may be differ for different organisms or differ for different animals, and different person to person is vary. Same substance, yesterday last class we have discussed that whenever we are same one glass of wine, one may be consumed, that is not taking some response, but same one glass of wine another person consumes, that is taking very serious effect. So similarly, how these toxins are react in our particular organism, that is called toxicity. So severity of toxicity may also occur. Then toxicosis, this is a state resulting from exposure to poisons, terms that is caused by inherently or poisoning of incotoxicity. So there are different types of small differences there. Toxicosis means your exposure to the poison for a term, for a 1 month, 2 month, or 1 year, or 5 hours. That is the exposure of the one. Let's say examples. If you are some worker is working in cement industry, and cement industry, various fine particles of cement gypsums are roaming around the air, and the person working in cement industry, they inhale the cement and the deposited in the lungs. So immediately that is not response in his body, but for a long time, for 1 month, 2 month, 3 month, that may be a toxicity, the toxic substance may be effect, and various problems may occur. That condition is called toxicosis. Last term is called hazards. So it is the likelihood of poisoning of living organism after exposure of toxicant, and chemical may not be hazardous and toxical chemicals. Some chemicals are may not be hazardous, some chemicals are hazardous. After exposure of some toxic substance, what is the may result occurs, that is the hazards. Then different branches of toxicology. Clinical toxicology, these are the one mark questions, maybe just remember this. Clinical toxicology, it deals with the effect of poison, toxicant on human beings, animals, either living organisms, and their diagnosis, treatment, and methods of the detections. Some poisons enter in your body, particularly humans. So whatever what we can just diagnose that what kind of poison it is. Then treatment, what are the medicine to treat, all these are when you are consulting a doctor, that is called clinical toxicology related to poisons, not diseases. Then environmental toxicology. Environmental toxicology is known as ENOX, which is multidisciplinary field of science, because environment is a multidisciplinary, and various harmful pollutants, chemicals, agents are living in the environment. So if you are exposure to some carbon dioxide gases and sodium what is that called, SO2, NO2, different gases and different toxic in environment, then that type of toxicity is called environmental toxicity. Then forensic toxicology. Forensic is the used toxicology term that other disciplines may be analytical chemistry, pharmacology, clinical industry, that micro investigation on depth of the poisoning and drug cases. This is called foreign toxicology. Like for example, if someone is eating some pills and it can react in his body, so how it can be cure or how it can be detecting. So for example, someone is eating some poisons and death occurs, so investigation of that kind of thing is called forensic toxicology. Then regulatory toxicology, it deals with the administrative functions concerned with the different types of toxicology testing program, distributions of the chemicals, etc. For example, if you new drugs and new vaccines and new things can be product is be given to markets, so before that they are going to test this whether it is safe and how much amount will be safe. The dose as well as this product can be tested for different peoples. These and they are forming some rules and regulations law that are comes under regulatory toxicology. That kind of study are there. For example, drugs, cosmetics, additives, food additives. So we are all using food additives, green color, or we are using that now what we call the gula, barf ka gula बोलते हैं. So that we are eating that color food, color syrup, sugar syrup. So that is very much injurious to our health. What how this can be regulation can be done for the things that are called the regulatory toxicology. Then different kinds of source of poisonings, how these are, so there are different sources are there. So natural sources and man-made sources. Natural sources, obviously various kinds of things are there. Man-made sources, they are accidental and malicious. The accidental means someone accidentally exposure to that. Malicious means they are knowingly or they are having long time, for example for working somewhere, that is malicious. So this is the different sources. We already discussed these factors, dose, how much, what is the concentration which is the effect to the toxic poisons. Today we are discussing about not only the chemicals, only for the poison type of thing. So this is the dose, how much amount is required. So physicochemical properties, what is its properties are there. Then nature of exposures, there are four kind of exposure discussed in yesterday class or last class. That is the exposure through gases or through lungs by inhalations. Second exposure is through skin or dermal exposure by touching the chemical. Third action is by eating through food. It can be a exposure that can be entered to your body. And fourth is by injections directly mixing to the blood. That is the fourth action. So what kind of exposure? Then route of exposure, which how it can be entered in your body. Then age. So but the poison is effect in different age group differently. Then sex, also that also male and female the poison also effect differently. Species, how which kind of species are exposed to that. Then pathological condition, etc. Because someone is having more immunity, do not having any disease, they are not so affected by the small amount of the dose of the poisons. But someone is having previously some disease persons, but and they are more prone to exposure these poisons. Then treatment of poisoning. So what is called treatment? To decrease the absorption of toxicant. First thing is to stop this incoming of this toxic substance to the body. That is decrease of absorption or distributions. If someone is exposure more into the environment or some toxic substance, the first thing is to cut the exposure route. Second is to increase the threshold level of toxicity. Second thing is to increase the resistivity of the toxicology. That is the resistivity of the toxic substance. That is called threshold level, means the limit or the resistive limit of particular drug to your body, just resist or to develop or adopt that level. So high amount of dose, that adaptation. Third is increase the excretions of the toxicants. If it is already inside our body, we try to immediately remove before going mixing to the blood. We try to immediately remove the toxic substance from the body. For example, if someone is eating some toxic substance, so what we can do, we just vomiting that before immediately, so that cannot be mixed with our blood, so the toxicity may be treated. So these are the process of treating. So at we are studying about environmental health and toxicity. So particularly in environment, there are different kind of pollutants are there. So every pollutants having different kinds of toxic effects. So one of the such chemicals is called arsenic, and this arsenic is a metalloid which is having high amount of poisoning animal in severe effect on organic as well as inorganic compounds. Its ability, the arsenic is a very serious element which can be add in any kinds of organic inorganic compound. It may enter through your food, it can be mixed through your or water everywhere. So this is the most severe chemicals, or let's say the toxic substance. Arsenic is the toxic substance. If someone is exposure to arsenic, then it may be health is severely affected. Inorganic essential, inorganic chemicals are arsenic trioxides, arsenic pentoxides. So there are different chemical forms of arsenic which can be available in our atmosphere, available in our environment, that can be enters. So what are the sources where can we get arsenic? Herbicide, weedicide, wood preservative, etc. So that herbicide or insecticide we are using, or that wood preservative, the coloring of wood, when we color the wood, that is also or paint and arsenic also used. So that is the source of arsenic. The mechanism of actions, how this arsenic can be directly entered into the body. So you cannot go, but just for knowing purpose, arsenic directly react with the alpha lipic acids that is present in our enzymatic activity. So that directly related to our different kinds of enzyme activity in our body, in our metabolism. So directly that can be effect. Clinical finding, the proposed water bath, that is the Rick water, brick and mucous membrane treatment. So whenever we are, how someone is, we are knowing that someone is exposure to arsenic activity, so we are testing the blood testing or some muscle tissue testing, body part testing. So that is the finding of purpose. Then how the treatment can be occur, that is dimethylcalpol British lower 4-5 mg. This is the amount, or this is the drugs in respect someone is exposure to arsenic toxicity. So we give this kind of things. So thyrotic acids 50 mg per kilo. That is the different kinds of drugs or treatment methods of the arsenic toxicity. Just remember the chemicals name, toxin name, and sources, and how it can be react. So this is the first chemical, that is arsenic. Second is mercury. Mercury is also found in our environment in various way, and it is also very high toxic chemicals, or it is a metal, actually liquid metal, and the name is quicksilver. That is, whenever you see the mercury, it like a silver color. So and it is metal. So it is also found in various way of in environment, in our environment. And this mercury, when react with some uh, organic compound like methyl ethyl, so ethyl mercury, methyl mercury, so these are very highly poisonous, or high poisonous to the uh, some living organism. So the mercury compounds are used as fungicides and medicinal purposes. So like this insecticide, herbicides, the treatment, the treat the kill the insects, or some like fungicides they are used here. But accidentally or by somehow, if some animals or we are maybe exposure to mercury, then it can severe health effect. The most important mercury hazards, mercury toxicity hazards is the Minamata disease. When in Japan in 1950, they are eating, actually Minamata is the town which is situated in near the sea side of Japan, one of the sea, and where they are used to eat the fish caught from the sea, and the fishes which having high level of mercury, because near to there is a mercury plant or pesticide plant is there, they are releasing their wastewater into the sea, and the near to the sea animals or fishes, they are used to eating this mercury. So whenever the men are consuming this mercury types of fishes, then that huge number of people are infected, and many of them have died. So that is called Minamata disease. So we just know what is the level of mercury poisoning first time for the first time. So mechanism of action, how this mercury can be effect. So mercury effect to our kidney mostly and brain. So functioning of kidney and brain can be damaged by the mercury. Directly react with the proteins and the DNA, RNA directly. So it is very highly poisonous when mercury poisoning. Mostly particularly when it reacts with ethyl or methyl alcohol, that is methyl mercury or ethyl mercury. Chemical sign, how it can be a sign: head poisoning, convulsion, gastritis, depression, bloody diarrhea. These are the symptoms of mercury poisoning. Then treatment, this BAL, this is the one kind of chemicals or some treatment methods or they are using. So just remember the sources, actions and the sign here. The next poison or toxin, that is called lead. Lead is a heavy metal commonly used for poisoning of domestic animals through the world. Mostly the effect from the animals like cow, cattle or buffaloes, goat, they are fastly affected by the lead. After then, by contact with this men with these animals, domestic animal, men are also come contact. What are the sources? Drinking water, lead, business, paint and other sports. Lead, most important source of lead is the battery. Whenever we are you after discharge of the battery, we are just throw the battery in garbage, and which is the most dangerous action, because the lead containing high level of lead, battery containing lead, and that when we dispose in our garbage, that is the cause the lead poisoning. And whenever it contact with the water, that also industrial wastewater or some dispirited water, the lead also present is there. And then in some paints also they are using lead. So these are the sources of lead. Then how it reacts, the lead also react to our enzymatic activity and directly mix to the blood brain barrier, that is the what may we call, that it directly react to the brain, and it can be causes different cerebral edema. That means your brain functioning becomes low, become dizzy, and some kinds of madness type of things occurs when lead poisoning is more. So directly affect to your brain. So how it can be sign: hyperexcitability, blowing, muscular pain and headache. All these things are also occurs when it is the initial toxicity sign of the lead. So treatment, when lead poisoning is treated by this EDTA, that is some thiamine or some, these are the drugs we use to take in counter effect the lead. So first is arsenic, second is mercury, third is lead, fourth is copper. Copper is also a very essential element that catalyze various processor and different iron adjustment, because copper also when you use excess quantity, that is also containing high content of toxicity. So what are the sources? It contaminate food, water and agricultural variety practices, veterinary practices. Mostly whenever we are drinking or eating the contaminated water and food, that it enters in our body. So mostly the copper found in the milk of the some infected cattle or the beef or infected meat, when mostly these copper are toxicity is found in western country where they are used to eat beef. And these animals, they are exposure to copper first, then through them also it is enter into our body. Or some people are used to eat meat, pigs or poultry, then they are having more chance to affected with the copper poisoning. Then what is the mechanism? When copper is mostly inflected to your lipid processes, and it can causes different kinds of vascular or intervascular crisis. That means whenever a failing or frazzling all these muscular thing. What is the sign? Gastroenteritis, rapid salivations, anoxia, diaposmia, pale muscle pain, hemoglobinia. This is these things. When copper is more into body, this kind of things happens. Treatment is some kinds of sodium sulfate is taken by counter effect the copper. Next is molybdenum. This MO is essential nutrients for plants and animals, and this is also used for the oxygen transfer reactions, some kinds of reactions. These uh, things are very much re, uh, rare, but someone is exposed to this kind of activity, then it can be very highly affected to that. So what is the molybdenum toxicity or mo toxicity? Interacts with the copper and sulfur and increases the complexity inside our body. So mechanism will directly react with the copper deficiency, all the things, sign, diarrhea, salvations, eyelids, that is, muscular pain, etc. This is the molybdenum toxicity. Then next is selenium. Selenium is the essential element also. Just they are various deficiency diseases like white muscular diseases. Source of poisoning. What is the poisoning? It can be effect through the different kinds of adenopsids or all the SC intermuscular plant and different kinds of eating different foods enter to the body. So factor, what is the factor? It also having a lower toxicity than other because it is very much less and rarely it can be entered to the body. Then more, another is fluorine. Fluorine is a commonly used, that is called biogenic element, that is micronutrient. It is also essential in our body, but whenever it is excess by eating the fluorine into the body, that also, and it enters our body, that is drinking waters and also these are the causes to death teeth. So fluorine is mostly effect to your teeth, yellowing of teeth or teeth decaying. That is the most common found in some humans, that is the fluorine, due to fluorine toxicity. Due to the sources are the industrial pollutions, mostly aluminum plants and aluminum or this metal plants, wherever processing industrial area they are releasing the wastewater, phosphorus fertilizer plants, all the things, glass factories, these are the sources. They are releasing the fluorine in high amount, and the person working in the particular industry and near living the nearby area, they are mostly exposure to the fluorine toxicity. So that is 95% of fluoride is stored in bones, so your bone also get that is fragile. If fluorine toxicity high, then bone become fragile, easily bone can be break. So this, and teeth fluorosis, teeth can be also broken, and that yellowish of teeth takes place. These are the different signs. Then treatment for this calcium carbonate, all the calcium sulfates are taken for controlling this fluorosis. Next is nitrate and nitrites. This nitrogen, which is also found in environment in most significant way, that is nitrogen atmosphere, that is 75% is nitrogen, or 70%, sorry, 70% is atmosphere is contain nitrogen gases. But that gases is neutral, that does not affect our any animal body or anything. But when nitrogen is combined with oxygen or NO3, NO2, that enter to your plant, enter to first plant and then enter to the animal body, and it can causes toxicity when we consume excessively. So these are the different, what are the sources are different kinds of plants, mostly leguminous plants are there, and these plants they are enter to the animal body. Methanohemoglobina or vascular shock, this is the one most popular peculiar types of reactions of this nitrogen in the blood, that is called methanohemoglobinia. That is the uh, it nitrogen combines to the blood in place of oxygen, and the oxygen carrying capacity of this blood is decreased. So particularly this type of syndrome or this type of toxicity develops mostly in child. So the body of the child become bluish. So blue baby syndrome, that may be called as blue baby syndrome. Or the whenever you see the body color is bluish, then it may be know that the nitrate is toxicity is occurs. So treatment is methylene blue, or it is all these things are. Then is salt. This common, we are taking salt every day. So as the salt is necessary to our body, but what happens when the salt is excess in our body, that also create toxicity problems. So this salt are enters into the body through different kinds of our food, mostly food and water. And mechanism of toxicity is directly disbalance the sodium ion water balance, and whenever excess amount of salt is, and when you someone is ingested, then it directly thickening of the what the blood can be takes place. So iron are mostly dispersed from your blood, and your kidney may be affected due to the kidney, because the kidney try to filter all the salts from our body. So kidney damages, and This type of things happens. So if you eat or consume more salt, then you feel excessive thirst. So you are feeling thirsty, and thirst is never gone. And salvations occurs, dehydrations occurs, your body water is losses. So all the things happens. And treatment is the most important treatment is the drinking of more and more water. Then next is called urea, and this urea is the one form of nitrogen toxicity, and it is the gases or sources is ammonia or urea. These are mostly water soluble, and most urea poisoning of sources is the latrine or urinal or some municipal solid waste or wastewater. Whenever or you smell a foully pungy smell in one common go to a common bathroom or washroom, so that is due to the urea. The smell is urea or ammonia. Urea convert to ammonia. So this ammonia, excess ammonia can be called by microflora and absorptions from this toxicity. Directly, urea can be entered through inhalations, or it can be contact. It can be when it contacts on your skin or through dermal. You can those urea can be entered the body. So when urea is excess in your body, some then what happen? Abdominal pain, then what called dehydrations, and gulping, blowing, technique pain, all these things occur, muscle pains, these occurs. So there are some treatment also there. So just remember the name of the toxic substance and what are the sources and how it can be react in the body. Then different agrochemicals. These are various kinds of chemicals we are used, humans are used in order to kill insect or kill herbs that are called insecticide, herbicide, etc. So first, these actually this insecticide, herbicide, these are highly toxic substance. If you enter to your body or a human animal, a human's body, that can be causes death. So you heard so many people when they are attempting suicide, they are just eating or drinking some rat kills or some kinds of insecticide, pesticides, etc. They are drinking a full bottle of that. So that can be causes death. So these are very highly in toxic substance are there. Insecticides are four kinds: organochlorine, DDT, aldrin, leadin. These are the name of these chemicals. Organophosphate, parathrin, malathion, diazian, carbamates, aldricab, carbaryl, or these are the things. Then pyrethroids, althrin, paramethrin. These are the chemicals name whenever you go for a agrochemical shop for buying pesticides, all the things you are this found this name. Then second is herbicide. Herbicide, insecticide means to kill insects. The chemical used to kill insects. Herbicide means the chemical used to kill the herbs or the unnecessary grass in our agricultural field. That is the herbicides. That is diaquat, paraquat, azitrine, etc. 2,4-D. Then fungicides. Fungicides are to kill fungi. That chlorophyllols, diethrocarbamates. Then rodenticides. These are the rat kills we are normally use in our home to kill the rat or rodent. Alpha nitrogen, theoria, zinc sulfate, red squill, this warfarin, pondin, all these are the different chemical names which are used to kill rat. Then mycotoxins, these toxins which are generated by different kinds of things or different living organisms, they are called mycotoxins. This is alpha toxins, rubytoxins, nephrotoxins, osteogenic, cryotoxins, neurotoxics. See, these are the different kinds of substance which can be, name of this substance is related to this kind of how it affect. For example, hepatotoxics. Hepatotoxics that directly affect your blood, that is called hepatotoxics. Nephrotoxics, whenever the substance enters your body, directly affect your nephros means the nervous systems, your brain. Osteogenic. Osteogenic meaning when you and the substance enter your body, it directly affect to your stomach or your digestive system. Cytotoxics. Cytotoxics also directly affect to your blood. Then neurotoxics, these also affect to your nervous systems. So this is all about different kinds of toxin and how it can be found in our environment and what is the effect on health. of these toxins in our body. So then come to our next part, because we have to finish this before your mid sem. So next part is different kinds of wording, or what is the severity, or what is the multiplicity, complexity of this toxin substance that can be we denote, that is, let's say, discuss on it. Let me share my screen again. Okay, is it visible to you? Okay, so unit used to measure this toxic substance in environment, because we are uh, study all this environmental related, health related toxin mostly, and we are do not discuss the different venom or this type of different more toxic substance. So what are the units? Units are ppm, parts per million, ppb, parts per billion, and ppt, parts per trillion. See, the substance or chemicals or the toxic substance are very toxic substance even if you are consuming very less quantity. Parts per million, very very small quantity. Parts per billion or small quantity. One parts per million is 1 inch per 16 miles, or 1 cent 10,000 to the examples. So this is a very very low quantity, you already know this. Parts per billion is, that is, I will skip these things. So when reporting the lab results, 1 liter of water, that is 1 kg, or 1 mg per kg, that is called 1 ppm. Wherever you are working in different your lab experiment, so 1 ppm means 1 mg per kg, or 1 mg per liter, or 1 mm per liter. These are the mostly unit. This maybe comes in your exam or internal exam for 1 mark questions. Then a majority of toxicity. How we can measure the toxic substance? So toxicity is the measuring of the responses of that substance. That is called toxicity. So toxicity chemical determined in laboratory. So the normal procedure is to exposure the test by animals. Whenever we test the, we are going to for a blood test or for a some kind of tissue test. So by testing these things we may no, so we can see the toxicity by injection, by ingestion, application of skin, by inhalations, and methods of introduced into the body. So by placing the test material in the water or air environment, we can also test. Whenever we are sample water is collected and we are testing the water, the how much this substance is present. After that, we can say that this is the toxic substance. Toxicity measures as clinical endpoints, which is includes mortality. So how much peoples are dead by eating that chemicals, that is also one kind of majority, that is called mortality. Teratogenicity, ability to cause birth defect. If someone is not died, but the one it is also difficult to take bath. Nowadays, you have seen most of the peoples which are not giving normal bath, a normal bath of child, because due to the food habit and these toxic chemicals which are not react immediately, but due to various days or this long term effect, that is called chronic effect, the giving bath or a not having child is the common problem nowadays. This is one kind of toxicity, teratogenicity. That type of toxicity is called teratogenicity. Then carcinogenicity. This is which can already substance which is cause cancer, and this is called carcinogenicity. Then mutagenicity, ability to inherited change in DNA, because this also some chemicals that changes our DNA, and on the that is called mutation. You have seen different kinds of Hollywood movies and all these things, how mutations occurs. So these are kind of things. So at this time we will discuss only two measures, only LD50 and LC50. Last class we already discussed LD50, that is a lethal dose 50. That means the amount of the chemical, the concentration of chemical given a particular group of organisms, then if the 50% of organisms are died, that is called LD50. See, here it is the material lethal dose. This is called lethal dose. LD means lethal dose. So what is the definition? Please remember this one because this is an important question for you. The amount or dose of chemicals which produce death of 50% population in test animals. If there are 10 animals are there, or giving 5 mg per some chemicals is to them. If after that giving chemicals 5 animals are died, then this 5 mg is the LD50 or lethal dose 50. So if 50% of animals are died, that amount of the concentration is called LD50. That may be in mg per kg or whatever may be in ppm, whatever may be the unit. Normally expressed in mg per kg or ppm. Then material lethal concentration. Lethal dose LD, lethal concentration is LC. This is similar to LD, but whenever the concentration of chemical is generally given in water, that is called LC. If the toxic substance is given for the test animals in water soluble or water form, that is called LC or lethal concentration LC50. That's the milligram per liter because it is water is measured in liter, so unit is milligram per liter, but LD is milligram per kg because it is not in water, it is in solid form. So primary route of exposure of pesticides we already discussing in previous class. What are the routes? Oral by food, then dermal means by skin, inhalation by lungs, and last is injection by mixing directly with the blood. So oral, what is the oral exposure? It pesticides which occurs more than chemical taken through the mouth and passes through the gastrointestinal tract. That means whenever you are consuming the pesticides or consuming the chemicals or toxin through mouth and directly go to your stomach, and after stomach it is mixing to your blood, that is called oral exposure. During oral exposure carried within the body, pesticides still out through the body cavity. When you are excrete or in your along with the stool, some pesticide is moving out. Then primary route is dermal. Most of the things we are exposure is dermal or through skin because pesticides or some toxins, whatever may be toxin chemicals, if someone even if not consume, if it come contact with that chemical, if touch the chemical, then also it can be entered through your skin. That is the most primary route. The proper hygiene of this exposure is not serious, so it is matter concerns. This is very serious. Then primary route of is exposure. That means whenever we are inhaling this substance, it enters through your nose and through lungs. It can be also causes things. Then duration of exposure. There are three kinds: acute, chronic, subchronic. Acute means immediate, chronic means after a long time, and subchronic means immediate. Acute means application of short term or by chemicals, that is called acute. Already discussed these things. Chronic means this is a long term exposure or that is half life of the substance is very high, that is acute. Half life means the amount of substance which can retain in your body without excretion, that is called chronic. Chronic toxicity means long term toxicity. Then subchronic means the symptoms are also appears immediately, but also it also in long term, both way, that is called subchronic. So for this mostly pesticide are toxic chemicals referred to here because these pesticides which are nowadays we are eating different kinds of fruit, vegetables, and these all these things are contaminated with these pesticides. So indirectly we are, whenever we are coming to market and buying some fruits and vegetables, you are exposed to pesticides or this toxic substance. So this LD50 of 20 mg per kg is more toxic than 7,000 mg per kg. So this lethal dose, whenever we are talking lethal dose, which is more toxic than other kind of things. Then next last part of this toxicity is the how we know the risks of this toxicity. How by looking these toxic chemicals, how we assess or what is the precautions or what is the terminology we can say that is the chemical is safe or not. So see the sign safe, it easily cross that. So that means it is not safe, but low risk. So this kind of thing is no low risk. It is having risks, but it is not safe. Last class yesterday we already discussed this thing, risks, accessibility. So some words are there. Whenever you find these word in some chemical bottles or toxic substance, some labeling in various kinds of bottles of these pesticides, you have seen. What are these kind of things? The relative acute toxicity is related to this signaling word. What are the word? The word are caution, warning, danger. So these are the three words which are labeled in the different kind of poison or toxic chemical bottle. So what? How this first word is caution. Caution means they reflect lowest degree of relative toxicity. Caution means it is no so much high danger, but you have to take precautions before it is. But whenever you exposure also these things, but it is low risk. That is a caution. All pesticides of LD50 greater than 500 is under this category. 500 mg per kg are uncommon under this category, that is caution category. Actually, it includes two groups: relative non-toxic and slightly toxic. Some chemicals are non-toxic, not toxic, but it's chemical low risk. That means, and slightly toxic. It is not so much toxic. If we touch this chemical or something, that also nothing happened. For example, if you are touching the chemicals, let's say that is called ethyl alcohol or some acetylene. So these are the normal chemical we are using in our laboratory. These are also a chemical toxic substance, but it is not so much danger. But whenever there is so H2SO4 HNO3 chemical, this is not caution. This is very danger. So this is caution means less risk. Then warning. Whenever the substance or the chemical bottle signs that warning is there, so that means it reflects intermediate degree of toxicity. It might be affect you not high, but somehow it can affect. So LD50 is greater than 50 and less than 500. Please remember this one. 50 to 500 mg per kg. Then it is called as warning level of things. Warning means intermediate level of toxicity. Pesticides which is category are called moderately toxicity, not high or not less. This is called warning category of toxicity. The last is whenever the bottle is sign as danger and there is a symbol for danger, or that is a skull and the two bones are there, that means the highest degree of toxicity. It should not be come contact with that kind of uh, toxic substance. The LD50 is less than 50. So that means the whenever you are come contact with these pesticides or these chemicals, that is highly risk to you. So pesticides are called highly toxic. So this is the three words. One is called caution, third is called warning, second is warning, and third is called danger. So these are the wording. And caution means greater than 500 LD50. Warning means 50 to 500 LD50, and danger means less than 500, sorry, less than 50 mg per kg LD50. So this is the things. See, there is a skull and there are two bones are there cross. That means it is danger. And last is poisons. Legally defined the term do not like, because everyone the poison is LD50 or less level, though it is highly danger or it can be called as poison. So level this in display skull and the crossbone icon. This is the most important thing. The poison, that means highly danger chemicals that may causes various effects to your body. Then another come to another term that is called relative toxicity. Relative things. Relative means single thing is not so important, but when you take these chemicals along with others, that causes very severely harm to that. So organisms cannot differentiate between natural and systematic chemicals. So synthetic does not mean toxic or poisonous, and natural does not mean safe. So see here we are seeing having two kinds of words. Synthetic chemical, it does not mean it is a poison, but natural does not mean it is safe. So might be it is a low risk, and synthetic is also a poisonous. So chemical must evaluated through biological and behavioral organisms. Before coming contact or before handling a chemical, you should note or you should read all the safety precautions in the, for example, all of you are using laboratory chemicals, and before entering using the chemical, you must read the safety sheets. Every chemicals there is a safety sheets that is comes with this chemical. So go and read what are the causes, what are the effect, severity, how this can be, what is the remedy, what are the symptoms. All are written in the safety sheets. So you go and read before handling that chemical. Then mode of action, not sources, concerns or toxicology, uses pesticides. So before all these things, so relative toxicity, all are pesticide created equal. So herbicide or some parts of human, some are the highly toxic. So some kinds of chemicals which are react highly when it is combinedly enter to your body. So some examples pesticides, animals, these are having highly risks and some are low risks, but having they are relative when entering the body. So these are the different toxicity of the name of the toxic chemicals, that is TCDD, dioxin. It is highly toxic. So 0.1 mg per kg is the very highly toxicity. Paratherium 13 mg per kg. Nicotine 50. Nicotine is the chemical found in your cigarette and BD or all this tobacco. This is the nicotine. Sodium fluoride 52 mg per kg. Carbaryl, malathion, these are the insecticides used for our kill the pest. And in this insecticide once spray in the agricultural field, although it kills pest, but it is written in the vegetables and foods, and we are indirectly eating that vegetable and foods. So if the amount is more than this prescribed limits, then it can be causes seriously effect to your body. Then these are some other chemicals: paraquat, 2,4-D, thyrochlor, dichromia, hexachlorine, clostolene, limousin, diesel, parachlorine, kerosene. See, these are also some chemicals having high amount is very toxic substance for them. Comparative toxicity. So let's compare highly toxic chemicals and moderately toxic chemicals. If some chemicals is uh, dioxins, parathion, nicotine, these are highly toxic chemicals. And paraquat, caffeine, coffee or tea, that is also a highly toxic chemicals. Sorry, it is not a high toxic chemical, but it is a moderately toxic chemicals. That is 200 mg per kg is safe. So if you are drinking at least one or two coffee cup per day, that is not effect to your body. But if you are drinking 10 to 15 tea or coffee cup a day, then it is also seriously effect to your body. Carbaryl, malathion. So these are these chemicals. See, nicotine whenever cigarette smoking is highly dangerous than the coffee, drinking of coffee, eating of coffee. So that is cigarette smoking is highly toxic chemicals of nicotine, and coffee is the moderately toxic chemicals. Then slightly toxic chemicals are there here. What are these? This 2,4-D, trichloride, aspirin, vitamin B3, tablet, salt, all they are the slightly toxic chemicals. Whenever we are using the aspirin is the chemicals used to recover from the headache or some body ache. So we are just using the drugs because this is very less toxic substance. Common salt or table salt is also when you are eating more than 3,700 500 mg per kg, it also causes toxicity, but very less toxic. So every chemical that is toxic. So we know how the chemicals, whether severity of chemical, whether it is highly toxic, slightly toxic, or moderately toxic. Three kinds of severity. So according to this table, or you can know what are the different chemicals and what are the capacity or toxicity level. So all substances are toxic. Obviously, already you will know all substances are identified in the degree. So, for example, sugar. We are eating sugar, which LD50 is 30,000 mg per kg. If you are eat sugar 30,000 mg per kg in your body, then that also causes severity. So eating sugar, that causes diabetes. So diabetes patients are also stop from eating sugar. So that is also one kind of substance of the chemicals, or that is all causes toxicity. Ethanol, that is the common alcohol. Some people are drinking every day, but Gujarat they are not going to find that. So if you are eating or drinking, someone person drinking 13,700 mg per kg, then it also causes highly toxic. So because it is, see, it is every chemicals which is having its toxicity, but the limit decided, doses decided. Even water has a LD50. If you are using water more than 80,000, then also higher water, that is also cause a toxicity, because if you are drinking water more and more heavily water for 20 liter, body requirement is a 4 to 5 liter water per day, but if you are drinking 40 liter, 30 liters, 50 liters, then what happen? Your unnecessary pressure on kidney takes place, so it can be also cause toxicity. Then the last part, that is pesticides are chemicals introduced in the different form of functions through foods and waters, and it should be uh, but some household cleaner, gasoline, kerosene, bleachers, paints, all are everywhere we found the toxic substance, and we should, but these substances are very less toxic, and we are mostly affected due to the substance which is highly toxic substance in acute or chronic type of effect. So this is all about today's you should be complete unit 2 here, and up to this all in your midsem exam. Oh, what is the day for your midsem? For us it is 12 December, I think. Anyone?
Sir, from 2 to 7.
No, no, particularly for this topic, this environment health safety topic, the date is you should read all these things, or unit 1 and unit 2 up to this it will be comes in your mid sem exam. So if you have any questions on this toxicity or this toxicology, you can ask, or I will already uploaded these slides in your PULMS, you can see there. Today I will upload these 2 slides also, and go through it and read carefully.
So exam is on 6th December.
What is the date? 16.
Sir, 6th
6/12,
December.
2024.
Okay, okay, okay. Okay, so 5 day more for it. So all you have tested your PULMS, all the things are working or not?
Yes,
Yes,
it's
sir.
working.
Okay. So all the best for your exam. And if you have any doubt, then you can ask, or you may contact on my WhatsApp number also if you have any personal doubts, so we can clarify.
Okay, sir.
Okay, that's for all.
Sure, sir.
Thank you. You can leave now.
Thank you, sir.
Thank you.